My name is Catherine Carter. I'm an APRN in Bridgeport, Connecticut. What type of APRN are you and what type of training did that involve? I am a family nurse practitioner. The training for that involved a 4-year undergraduate degree in nursing, followed by a 3 years master's program in nursing. I have a chosen subspecialty of family nurse practice, but there are other fields that you could go into for your master's, including psychiatry, acute care, emergency. My specific program was 3 years, but courses do vary from 2 to 4 years depending on the field you choose. Can you tell us what a typical day looks like for you? Right now I work in a hospital and I work in the internal medicine department. So I work as an overnight hospitalist. My day typically starts at 5 p.m. and ends at 5 a.m. I am working 3 nights a week. Overnight, we are responsible for patient admissions, discharges, transfers. If a patient needs to be evaluated for pre-op clearance, we can do so overnight. We also are responsible for responding to any patient emergencies or patients that need to be evaluated urgently. We also have support from our ICU and anesthesia team if there is a code or a rapid response. But any patient evaluation or any patient emergency that happens overnight, myself or 2 other MDs that are covering the house, we typically respond to that. What made you decide to go into your field, and did you always know it was what you were meant to do? I get this question quite a lot. I think a lot of nurses get this question. I knew I wanted to be a nurse from when I was very, very young. I feel like I knew I wanted to be a nurse since elementary school, but I didn't know I wanted to become a nurse practitioner until I was already practicing as a registered nurse for a few years. I began as a registered nurse on a telemetry floor, so I worked with cardiac patients and heart patients, and after that I progressed to the emergency room. While working in the emergency department, I really enjoyed taking care of patients of all different backgrounds, all different ages, and that really helped solidify my decision of going back to school to become a family nurse practitioner. One of the other reasons I decided to go back to school to become a nurse practitioner was because I still wanted to practice nursing, but I wanted to practice nursing beyond the bedside. So becoming an APRN, you really have greater autonomy, career growth, and I find myself having more personal satisfaction with my job. Family nurse practitioners do have the benefit of working in an inpatient or an outpatient setting. So you can work in private practice or a clinic. You can work in a hospital like myself or any type of acute care facility. And that's one of the reasons that I decided to go into family nurse practice, is just the flexibility and the vast job opportunities that I could go through my career. Which courses in college or high school did you find the most beneficial in preparing for your career path? I would have to say the sciences and my secondary language. In high school and college, I took Spanish and Latin as my secondary language, and knowing what I know now, I can't emphasize enough to learn a second language if you have the opportunity to. The patient population that I personally deal with is quite diverse. There are patients from all different backgrounds. And if I had the time and I had the opportunities, I would learn as many languages as I possibly can. As for the sciences, I would highly recommend taking organic chemistry or microbiology if your school offers that. You will have to take that in terms of, in college level, but preparing in your high school studies, I would highly recommend that if that's something your school does offer. How did you maintain focus to study and prepare for your exams and other coursework in your professional school? One of my biggest recommendations would be to make your studying portable and easy. So I would always carry flashcards or notes with me, so when I found 10 minutes when I was in a waiting room or waiting in line at the grocery store, I could just look over things and it wasn't so stressful when it came down to the weeks or days leading up to an exam. I would highly recommend not waiting till last minute to study for things because I feel like your stress load is a lot more and you're cramming information in that you're not going to retain long term. And just remember what you're learning as a nurse in your undergraduate and master's degree. It's how you're going to help take care of your patients. So you really need to retain this information. So slowly studying and putting aside an hour or two a day rather than studying nonstop for days leading up to exam is something that I highly recommend. Also, studying with a group of friends or a group of classmates is something that was really beneficial to me both in my undergraduate and graduate degree. Getting a different perspective on how to study and certain things to study. Working with a group of people really helped me see outside what I was comfortable studying and how I studied. And I really picked up a lot of study tips from my friends and my classmates that I went to nursing school with. One of the first extracurricular activities that I completed that really helped my nursing career was I became an EMT. In high school, my school offered an EMT certificate program, which I completed when I was 16. So between that and when I graduated nursing school, my undergraduate degree, I did volunteer on an ambulance and in the emergency department. That opportunity really gave me wonderful insight on the role of a nurse, patient care, and how, taking care of a patient in the hospital and how the doctor's role. So at that time in high school, you only know so much about what a nurse does and what a doctor does, but in working in that field and getting the opportunity to work directly with physicians and directly with nurses, it was a great opportunity to understand their role in patient care. As for internships, I did complete an internship when I was in my master's program. I decided to do my internship in radiology. Part of my job is to read and interpret, CAT scans and x-rays. So I decided that working one-on-one with a radiologist before I graduated would be a great opportunity to help me understand the field more. Right now, I am lucky enough to have students from my old university shadow me. It's very rewarding for hopefully both myself and the student. It's a great opportunity to give back, especially to those who, I understand what they're going through. I understand the challenges of balancing both academic and clinical stress. So to be a mentor to those students is something that's really rewarding. And if you get the opportunity to shadow somebody, whether it be an RN, an APRN, a physician, I would take up that opportunity because you learn so much from just following somebody around that you can't learn from a textbook. Another professional interest that I would highly recommend if you get the chance to do so is a medical mission trip. You can do those in your community or you can travel internationally. My undergraduate and graduate program did offer international medical mission trips that I did go on. We did go to third world countries and provide basic medical care to those who don't have access to that. At the time, it was something that I didn't think I would be able to balance with my studies. But looking back, it was very beneficial, understanding how the medical, understanding how to take care of my patients, and it really helped teach me about compassion and patient care, more so than studying it in a textbook or a classroom. So if you have the chance to do that, I would highly recommend it. And those can be offered at a undergraduate and graduate level. So please, if you get the chance to do that, please give back. As for personal interests, whenever I find the time, I like to travel for leisure. Traveling and taking time for yourself is something that I highly recommend in this field. I understand that working in medicine can be stressful, and it's a very demanding job. So, you need to take care of yourself in order to adequately take care of your patients. So whenever I get the chance, I do like to travel and travel with my family. When I'm at home, I like to bake and cook, which is something I think my coworkers and my family appreciate. And I also like to play with my dogs. Thank you.